I am the Director of Operations for Coeur Pediatrics. We have 3 locations in North Idaho, 16 providers in total. We were looking at how we can make our office more efficient, how we can implement strategies that can reduce the amount of time spent with the check-in process, and also capture some of that clinical data that the clinicians need to make decisions when seeing those patients. So when weighing out options, we were looking at some of the bigger players that were integrated with our electronic medical record system at the time. It really came down to 2 factors. First factor being looking at 5-year cost comparison. HealthAsyst was extremely more competitive. The second factor being the clinical integration. And being that we're a private practice owned by 4 of the physicians in the practice, they're the ones writing the check. And so therefore that clinical integration really piqued what they wanted and what they wanted to see, because it affects their day, right? It affects the amount of time that they're spending in the patient's chart. In terms of the clinical benefits of HealthAsyst, the ability for our clinical staff to integrate that information that the patients entered is tremendous. The seamless integration with our EMR has allowed that clinical medicine findings to be able to transfer over and have them readily available for the provider, which is freeing them up for the ability to spend more time with the patient, and also the nursing staff to spend more time with other patients, whether it be clinical advice over the phone or other areas of the office that they need to tend to.